I'm Nurse Jessica Seitz.
And I'm Nurse Erica.
And we're Nurses Uncorked,
the podcast that takes nursing facts
with nursing comedy and makes a little cocktail out of it.
Don't forget to hit that subscribe button wherever you listen to podcasts, and please rate, review, and download.
Hey guys, welcome back to another episode of Nurses Uncorked. Before we get into this week's episode, I want to give a thank you to our sponsor, Stink Bomb Odor Blocker. I also want to share some exciting news. We're doing our first patron-only Zoom coming up. So this is a chance, if you have not become a patron yet and you're thinking about supporting the podcast, we would love to meet you at the Zoom coming up in a couple weeks. Erica and I have a lot of fun things planned, right, Erica? So
yeah, and we're gonna do those regularly. This is gonna be our first one to kick it off.
Yeah, so there's a link in the podcast about becoming a patron. We are back with our second episode. Last time we called it Whiteboard Update. And we're thinking of changing it to Huddle Update. That's where we're at right now. And it's where we give you the latest news, the latest things that are happening, right, Erica, in the medical world?
Yeah, in the nursing world, in the healthcare world, just current events and things that are in the news that we think are of interest. And I think Huddle works better than Whiteboard.
I think so. I think a Huddle report, Huddle Update. Let us know if you like Whiteboard Update, or if you like Huddle better, let us know in the comments. But for right now, we're calling it your Huddle Update Report from Nurse Erica and Nurse Jessica Seitz.
Yeah.
So we're going to get into it, but I got a drink, Erica. Should I share my drink?
Oh, yes, please. I almost forgot. What is our cocktail of the week? Because it's too early here on the West Coast for me to do it. So you're doing the cocktail.
Somewhere. That's what they say. So I'm having a lemon drop martini. I can't believe I've never done this before, but
I've never had one of those.
They're delicious. It's almost like you're not drinking alcohol. It's crazy.
Oh, that's dangerous.
Yeah. It's 1.5 ounces of vodka, freshly squeezed lemon juice to your tasting, depending on how lemony you want it. You can add a tiny bit of simple syrup if you want, kind of like honey or anything else that you want, and garnish it with a lemon twist. So it's a lot of vodka, and just some strong seasonings. You just shake it up in a shaker and it's done. It's good. It tastes like lemonade.
Where's your Nurses Uncorked shaker? Your fancy shaker?
I had to send it back. Mine had a big old gash on it. So
no, really?
Yeah. So they're going to print me another one. But that's okay.
Oh no! Got the
Take it away,
garnish
Erica.
And everything.
Yeah.
All right. So we decided we're each going to pick 2 stories. We don't know what each other chose, so hopefully we don't have one in common. I don't know. I think that would be funny. And just things that are current in the news, good, bad, or ugly. Right? So I think I'll go first and we'll take turns. Okay?
Let's do it.
All right. One of the biggest stories in the last week or so has been the updates in the death of Matthew Perry, the Friends actor, who died in October of last year, 2023. But just last week, finally, close to a year later, they have charged 5 people in his death, which is crazy. So for those that don't know, he was found face down, dead in his hot tub in his home in California. He was found by his assistant, and the autopsy reports showed levels of ketamine in his blood that were equivalent or greater than what would be given to a patient in general anesthesia for surgery.
Mm-hmm.
So supposedly he had been receiving medical treatments of regular ketamine infusions, but those are at a much lower dose and would not have been equivalent to what was found in his system at the time.
Yeah, those
of death.
were I think routinely prescribed ones for treatment of bad anxiety, depression. So it's not something out of the norm, basically. It could happen. But not what they found in him, I don't think. That was something out of control.
No, and supposedly his last scheduled treatment was a week prior. And, it just doesn't stay in the system at that level for that long, to my understanding. It wouldn't explain the ketamine levels that they found. So basically, it was a ketamine overdose. And we knew that last year, but there's been a lot of talk about how did he get it, who facilitated this. And I think everybody kind of was thinking about Michael Jackson and that whole, he had a doctor that facilitated the propofol, that gave him injections. So there's been a lot of like anticipation for what might come from this case. So they have now charged 5 people. Okay. 2 of them are doctors. One is goes by Dr. P. It's Dr. Placencia. He has been charged with conspiracy to distribute ketamine, 7 counts of distribution of ketamine, 2 counts of falsifying documents, and faces a max of up to 120 years in federal prison. These are federal. Yeah, it's a big deal. Like, this is serious. These are federal charges because the DEA is involved. The U.S. Postal Service is involved for sending, receiving, I guess, ketamine, and also for falsification of documentation. So he is facing the most potential prison time, and he is, I believe, pled not guilty so far. He is also accused of allegedly witnessing one time where Matthew Perry blood pressure spiked, and then he kind of froze after administration of ketamine. So I don't know what the details surrounding that incident were, but
Matthew Perry froze?
Yeah.
Oh, I didn't know that.
Yeah, like some weird reaction. I don't know. But this guy is not an anesthesiologist. I read that he is a family practice physician, primary care, and also does some like pediatrics and internal medicine, but is not an anesthesiologist. Okay. The second doctor is a psychiatrist.
Can I just say before you talk about the second doctor, does the first doctor's name make you think of a placenta, or is that just me?
It's because you're an L&D nurse.
I guess. The first time I heard it, I was like, no wonder he goes by Dr. P. It sounds like Dr. Placenta. Okay.
Right.
Anyways, let's talk about the next doctor.
The second one, Dr. Mark Chavez, a psychiatrist who I guess they found previous social media posts where he was referring to the first doctor, Dr. P, as being his mentor. So they had some kind of a relationship, and he's charged with 1 count of conspiracy to distribute ketamine, which is up to 10 years in a federal prison. He runs an online platform called the Health MD, or he did up until 2023. And he is associated with a company called Dreamscape that offers ketamine and wellness, like 1 to 2 hour treatments. But basically, they're saying that they were getting these from wholesale distributors with fraudulent prescriptions in former patients' names.
Oh, so that wouldn't be tied to Matthew Perry, I guess.
I guess so. And they were charging like up to $55,000. And I guess these vials are $12 or something. Like, they were making money from this. And there was some texts between them that were leaked. I'm trying to find my notes. It said something like, this guy is crazy. Let's see how long we can keep this going, or how much money we can make off of him. Something.
I did hear that.
To that effect. Like, that's
allegedly.
pretty damning.
Allegedly.
Yes. Thank you.
Put that out there.
Oh, I found it. It says, I wonder how much this moron will pay. Let's find out. From September of last year.
Yeah, that's what they do. Once somebody's addicted to something, that people are willing to pay, especially if you got money. And that's what these I mean, essentially, it's a dealer. It's a drug dealer. I mean, I don't care if they're a doctor or not. They're still a drug dealer.
And 2 of the people of the 5 that were charged were essentially drug dealers. One was kind of like an intermediate facilitator. And one was this person known as the ketamine queen. She's actually really pretty if you look her up. And
what
her
a name
is Jasmine.
What a name to have. She's the ketamine queen, only 17. Can you imagine that being
Jasmine
your name?
Sanga. She faces 9 charges and is facing up to life in prison. And then there's the distributor person. I don't know what their name is. And the fifth one is Matthew Perry's assistant, Kenneth. I'm going to butcher the last name. Iwamasa, something like that. He has been his assistant for 25 years and lived in the home with Matthew Perry and is the one who administered the ketamine on the day of his death.
The assistant?
Yes. Who's not medical in any way.
Oh boy, that's bad. They might...
Right? Yeah.
Why didn't the assistant watch him when he went to the hot tub then?
He said he went out to do some errands for him. Yeah, and it gets crazier. So allegedly he gave him more than one injection that day, 2 or 3. Like he had one at 8:30 in the morning, had one around 2:30. And then Matthew Perry allegedly said, like, hey, heat up the hot tub for me. He got in there and the guy left. And so he was apparently left home alone. And, you know, I mean, it's going to stop your breathing, right, in high doses. You know, ketamine is an anesthetic, but you know, you have to be monitored for these things, right? So, and then if you're in water and you kind of slump down and fall asleep, well, that's, you know, like a perfect cocktail right there. So this guy is basically like, I was doing what I was told.
The assistant.
Yeah. But, and it kind of reminded me of nurses, you know, like, well, I was following hospital policy. I was doing what I was told. But where's your critical thinking? You know, you must know, A, that you're not a medical professional. You shouldn't be injecting anyone with anything. You have to know that ketamine was illegally obtained and that he's not using it appropriately and not being monitored. Like, come on.
Some people, I don't know. Some people are naive. I will say that. I don't know. Maybe they assumed that this is something that can be, if taught, administered by a family member or something. I don't know. I don't want to speculate on that, but I do think somebody would have to use enough common sense and know, if I just administered this to somebody and they're getting in the hot tub, maybe
I should at least keep an eye on them.
I would think, but maybe Matthew insisted, I'm fine, just go get the stuff.
He probably did. I mean, we don't know, but he probably did. And then there's all this other crazy conspiracy stuff where his last post on social media was from inside the hot tub that day. Posted like a picture of him in the hot tub saying how nice it was. And that he had posted the Batman signal, you know, like the call for Batman, right?
He loved Batman. He was a huge Batman fan.
And he had previously said, if he ever posts that is his way of saying, I need help.
Oh. And
posted something about cranberries, like a couple of cranberries falling or on a table. And I don't know if this might be a stretch, but people are saying that has a tie-in to, you know, the band, the Cranberries from back in the day.
Them. Yeah. Mm-hmm.
The lead singer died of an overdose.
Of ketamine or just an overdose or something?
I don't know. So it's interesting, you know.
Maybe he knew it was going to possibly happen at some point, you know.
Yeah, it's almost like he predicted it, and he kind of he wrote a book at one point, and there was some, now in retrospect, like some ominous things in the book.
Did you know that the ketamine queen he met in rehab? That's where he met. Yeah, they met each other in a rehab facility.
Really?
That's what I read, anyways. Yeah, that's how they.
So she wasn't just the drug dealer, the distributor. She was also.
Yeah, they became friends, and they would meet each other like at lunch. So I think that's how she introduced him to these doctors that were able to administer it. But yeah, they met in a fancy schmancy rehab at some point.
I did not know that.
Yeah.
And so they're all also accused of kind of covering things up after the fact. The ketamine queen was supposedly getting rid of things in her home destroying evidence. The two doctors allegedly were falsifying documentation immediately
Oh boy.
following. So there's cover-up components to this as well. And now, I guess in California, there's these mandatory minimum prison sentences. So this is a big deal, and I think those are somewhat recent. I'm not sure. So, like in the case of Michael Jackson, it was Dr. Conrad Murray. He was sentenced to 4 years, I think, and served like 2, But
Yeah.
my understanding now is that the first doctor, Placencia, like he could, if he's found guilty, have a minimum mandatory of a life sentence.
That's a lot.
So it's a big deal. And I think people really need to start paying attention. What the hell is with these doctors thinking like, hey, you can practice outside your specialty
Because money
and without
talks.
monitoring? I mean, this is insane.
It's all about money. Money talks, and they convince themselves. There's a lot of crooked physicians out there. I mean,
it's
you
crazy
know that.
to me. I do.
Yeah.
But ketamine is like the new thing now. The last couple of years, the Take Care of Maya case, the Netflix documentary.
Yeah.
That had to do with ketamine, that she was, they were taking her to Mexico and putting her in a 5 or 8 day ketamine comas. And so it's only FDA approved as an anesthetic. But the last few years, people have been experimenting for
with other things,
chronic pain, depression, anxiety. And I do think that it shows a lot of promise, but it's not regulated in that way yet. And it's clearly being abused in some situations. But, a few years from now, we might be looking back at it going, yeah, it's great. It's great for depression. It's great for anxiety, but it's not FDA approved yet for any of that. So
such a shame. He was a talented, funny guy. Very talented.
He was so funny. Yeah. Yeah. So I'm sure there's more to come. 3 of them, I believe, have pled guilty, but the 2 doctors have not. So we might see some trials coming up in the future.
Okay. Well, that gets into the next story where another doctor's in trouble.
Oh, no. Okay.
This one was in the news a couple weeks ago. This article that I read is from August 8th, and this is out of Connecticut. Okay. And sadly, this trigger warning involves a fetal death during delivery. So just to kind of put that out there before I get into the story, because I know that can be definitely triggering for a lot of people. So there's this patient in Connecticut, Danielle McKenzie, and her boyfriend or father of the baby, Fabrice Diaz. And they're accusing a Connecticut doctor of pulling on their infant's head over 15 times or more with a vacuum. And they're accusing the doctor of going over recommended pulls on a fetal scalp, fetal head, because unfortunately, after delivery, the baby did not do well and ended up passing away about a day later from a brain bleed. So according to this article, the family during pushing lasted about 90 minutes, a little bit more. And what happened was, evidently the physician began pulling traction on the infant's head, and the vacuum suction popped off a couple times. So in researching, because I wanted to kind of be up to date on this, most hospital policies state no more than 2 to 3 pop-offs. Okay. But the varying degree as to how many pulls you can do is different hospital to hospital, depending on where you read. Now, I asked my husband this because I'm like, that's kind of scary that it's not. Yes, my husband is a doctor, OBGYN. I'm like, it's kind of scary that they don't have that much like studies on this. Like, we're putting this on kids' heads. But my husband made sense. He's like, think about it. Would you want to sign up for that study? Like,
Oh, shit.
as a mom. Yeah. Like,
That's a valid point.
yeah, hey, we might pull on your kid no times, one time, two times, 15 times. Like, it's
Right.
not something that can really be studied well. And that kind of made sense to me as
Yeah.
to why there's not like a lot of factual. So a lot of these recommendations will come from the manufacturer of the vacuum. And
Okay.
then the hospital policy and procedures can be different and varying in different degrees, hospital to hospital. But
What's the most that you've seen? Because your background is L&D. So
I mean,
what's
I have
typical?
seen, in the hospital that I was at, we were always trained no more than 3 pop-offs. So that doesn't mean 3 sets of pulls. That means you're pulling so much that you lose the suction and the vacuum actually comes dislodged and off the top of the head. And the reason for that being is because all of that traction and that suction and pulling can cause brain bleeds because
Yeah,
it's
it's gonna cause
suction
cerebral edema and all that.
and
Yeah.
when it's happening that many times, it's an indicator that the infant probably isn't going to come out from below. So it's like it's a combination of 2 things. You need to kind of look at those warning signs, and you need to kind of understand that you've got to weigh the risk versus benefit kind of thing. You know, do I want to cause edema? Do I want to cause possibly bleeding in the baby's head to get the baby out? Um, According to the family, they begged for a C-section at one point. Again, we've heard
Oh,
this before.
God. Yeah.
Yeah, and that other horrible
Yeah.
story that they begged, please, can I just do a C-section? And I think the physician said no, encouraged them to continue to push, and then came back in again and applied the vacuum,
Mm.
the handheld vacuum to the infant's head. And the family is also claiming that what they have been told is that a vacuum should not be applied for a total of more than 20 to 30 minutes total. Most places do say that most hospitals have usually 20 minutes,
And is
sometimes
that like a
30 minutes.
constant? Like for 20 full minutes, we're trying?
Yes. So usually
Easy.
what they do is they'll put the suction cup on the baby's head and they, suction it up. They apply the pressure, and then you only pull when the mom's having a contraction and the mom is
Oh,
pushing at the
okay.
same time.
Okay.
Okay. So there's breaks in between. So usually
Okay.
once
Got
the
it.
mom stops that contraction, stops pushing, you leave the suction on, but you relieve the pressure kind of in
Got it.
between. And
Okay.
then when it's time to start pushing again, you apply the pressure again. But I think the family's claiming that he did this over 30 minutes, that it was longer than 30 minutes. The article that I read didn't say exactly how long that they're claiming. Um, and that the parents' lawsuit alleges that the doctor inappropriately utilized the vacuum during Mackenzie's delivery despite known risk and knowing that there were inadequate maternal or fetal indications to do so. According to the complaint, the doctor used the vacuum to pull the infant's head a total of 15 times. The parents are saying that's 5 times the maximum number of recommended pulls with 2 pop-offs. That's a tricky area there because some places say you can pull up to 6 times during the descent phase, and
Oh,
then there's a number of pulls you can do once the head is actually crowning. But again, this varies hospital to hospital. Their policy and procedures might be different. Um, but regardless, I think the hard part to get away from is that the family asked for a C-section, begged him for a C-section, and it was denied. And sadly, the baby came back out with 4 apgars. Um, did have a severe brain bleed. Was on a ventilator. They transferred it to a critical hospital, and the baby, I believe, died a day later.
so normally when they use a vacuum and it's not an extreme case like that, um, does that automatically mean like going to NICU for 24 hours for monitoring or something?
Not necessarily. I mean, some kids come out great. They have,
Okay.
I mean, they might need to be watched. They might. you have to kind of assess the baby's head. It's all different. You have to see how
Yeah.
are they doing when they come out. Does it look like they have a huge hematoma? If it's bad
Mhm.
enough and it's bruised enough, usually we'll have one of the neonatologists look at it, and they may think to send the baby up to NICU. So I think it just varies. But I've had some that are assisted with the Kiwi, and you can't even tell. Like some of them
It's
come
called a
out
kiwi?
beautifully. Kiwi, yeah, that's one of the main brands
Okay.
of the vacuum. I don't want to say for sure that that's the one they were using, but
Yeah.
that's what we used at my hospital. Um, so that varies too. It just kind of depends. But no, they don't all go to NICU. But
Okay.
this baby obviously was doing bad when it came out. So it was sent off. But
So
this was at
let's
Greenwich. Do I say that? Is it Greenwich or Greenwich?
Greenwich. I think it's Greenwich. I think the W is silent.
Okay. Greenwich Hospital in Connecticut. So
Okay. So let's play like hypotheticals. I know it's we weren't there in the room. We don't know. But and kind of like the other case, right, with the baby being stuck. Like what were the nurses doing in the room at that time? Because I would assume, and not an L&D nurse, but if I'm in there and this is going on and we're like at over 20 minutes and all these attempts and mom begging for a C-section and it's
I
looking
would,
bad, like I would be speaking up. I would be getting the charge nurse involved, whomever involved.
yes.
Don't you think?
The hard part is, and I think we're always trained as nurses is, the doctor is doing something to the patient. So you want to handle it vigorously but gingerly. If you know what I mean? Like you don't want to necessarily alert the patient if
Right.
like you're
Yeah.
and scream at the doctor. I mean, your
Yeah.
kid's life and your life is in his hands. So you want to try to get somebody in there. Um,
Yeah.
what we used to do was we'd be like, "That's one pop off." Like we would say it out loud so that they
That's good.
recognized it.
Yeah.
That's
Yeah.
two pop offs. Like we would kind of say it in that. Now,
Like
if we get
wake
to
up
three pop
call.
offs, you're calling
Yeah.
for extra help in the room. If the
Or
physician is,
saying, "Would you like me to call for backup?"
and I've done that before, I'll say, "Would you like me to call neonatology in the room? Would you like?" Because these
Mhm.
flags already going up in your mind,
Right. Yeah.
Um, because sometimes it'll be up to the physician as to whether you need neonatology or not. Like if they think no, it's fine, it's going to be fine, they'll be like, no, don't call them. But you always have that what's the autonomy to
Mhm.
make that call. You have the
Yep.
autonomy to as a nurse to say I would like neonatology in here, or I'd like to get the charge nurse in here, or um
Right.
so
Yeah. You
you
don't
can
need
do that.
permission. Like it's a
But I
professional
think a
courtesy.
lot
We're
of
going to offer it once,
a
but
lot of
we do not
nurses
have
are
to.
nervous in going against the physician and doing it awkwardly right in front of the patient during a critical moment.
Right.
So what I would do is do like I would acknowledge, say out loud so that we're communicating, hey, I'm documenting, I'm seeing how many times this is, we're on 5 pulls, we're on 7 pulls now. And verbally communicate that. And if it looks like it's getting to the point that it's crossing what the policy and procedures are, then you need to get somebody your chain of command started and all of
Yeah.
that. Now, I don't know if what happened in this situation, but
I wonder if the nurses will end up being charged like the in that other case that is still pending. The
yeah.
nurses have been named. So that'll be an interesting one to kind of
And we'll
track
link
as it goes.
in the description that episode that we're talking about that sadly dealt with the decapitation of a
Oh yeah.
newborn
Yeah.
in the description if you're wanting to know about that story and you've never heard
Yeah.
about it. But we did a whole episode on that too. So
Yeah.
um, we'll
And
we'll link that
can
in.
I just say I think it's so funny how many L&D stories there are. Like I feel like our listeners probably think we're out there looking for L&D stories because you're an L&D nurse, but we're not. It
No,
just so happens the last couple of years has been an insane amount of crazy L&D stories gone awry, and also a lot of the violence in hospitals have taken place in L&D units. Like it's just crazy how many L&D stories there have
there's
been.
always, I mean, litigation and lawsuits is always higher in labor and delivery. That's just it's a known thing. I think a lot
Yeah.
of doctors don't go into it because of that. So I think with social media being able to get stories out there, we're just it's not that the trend is going up. I just think you're hearing more about them now
Hmm,
because you're
that's
you're
possible.
able to communicate it better. But sadly, this kind of stuff has been going on for a long time. But at least maybe patients are becoming educated in the process. I can at least
Hmm.
hope there's some kind of uh, something good that comes out of it. To know, hey, it's okay to question your doctor, or it's okay to, if you feel, if your spidey senses are off and something isn't right, it's okay to ask them to stop. It's okay to say, no, I want somebody else in here. Just be your own advocate. Sometimes you have to.
Yeah, absolutely. All
But yeah, we'll
right.
have to wait and see what happens with this lawsuit. But sadly, they don't have their baby anymore. And there's nothing that's going to change that. And that just stinks.
Yeah. Yeah. Now let's take a moment to hear a word from our sponsor.
Erica, you know what I've become addicted to?
What?
I am addicted to Stink Bomb odor blockers Evergreen. Like, I love all their scents.
It's so good. That's my favorite. It smells so good. It smells like Christmas,
It
you
does. It
know?
reminds you of the holidays, doesn't it?
Yeah, you just put a little bit under your nose, above your lip, and it blocks all the nasty odors that we have to smell at work. But I was thinking with the holidays coming, this is not only the perfect stocking stuffer, because look, it's so small, you can buy little packs or individual ones. They have all the different scents. Perfect for a stocking for the healthcare worker in your life, but also your coworkers. If you're thinking of something to get them, it's so affordable and so useful. This is something every healthcare worker can put in their pocket and carry with them.
Yep. And if you want to get them a gift set, you can do that. You can even get a little lanyard that they can hold their little stink bomb blocker on.
Yep.
It's amazing. So check out their website, stinkbombodor.com. There's a link directly in the description of the podcast, and they're generously giving 15% off for all of us. Use code UNCORKED15 for an additional 15% off. We're back. We're going to get into our third Huddle news report, Huddle update. Erica's
Yeah.
going to take the next one.
Okay, this one comes with a trigger warning. It does involve child sexual exploitation. So
Oh,
if that
gosh.
is something that will bother you, please don't continue listening. Okay, this one's kind of crazy. I think they're all crazy. But a nurse manager at Duke Health in North Carolina, in the trauma center, has been charged with 20 counts of child exploitation. 10
Gosh.
counts of second degree sexual exploitation of a minor, and over a dozen counts of copying child pornography. And it's a female manager, which I just feel is interesting because it doesn't fit like the typical profile, a 42-year-old female nurse manager was allegedly trading and selling videos of children engaging primary or only female children, interestingly, in sexual acts with adults as young as 2 years old.
Oh, God. I mean, if y'all could see my face, for those of y'all that are not watching this, it is, that's
Yeah,
disgusting. That is absolutely
yeah. Nothing
disgusting.
upsets me more than that kind of stuff, because my background is, those kids are in pediatrics, and those kids get so screwed up psychologically, of course, after being through trauma like that we end up seeing them again and again and again in the hospital for various issues, for till they're 18. So anytime I hear anything like this,
Was she
it's
a
the worst.
pediatric nurse manager on a
No, she was
pedi?
in the trauma
Oh,
the
trauma.
trauma
Okay.
unit somehow, or in the trauma center. So I don't
So
know if it was a
hopefully, not that
specific.
it makes it better, but hopefully none of these images were coming from work. I
Oh,
would
I don't
hope.
think so. No,
Okay.
I haven't read anything about that. They did go and search her home, and they did find her email address associated with all these different counts. So, like selling the child pornography, trading it. I
Oh.
don't know what are we trading for. I don't know how that works. I don't know. Like, is it just for funsies? Like, you send
I,
me mine, I'll send you your.
I will say it, like you said, it is very rare to have a female.
Yeah.
I mean, I know it can happen, but very rare for it
Yeah.
to be a female doing child pornography and with other very odd, very
It really is. I looked up her license, and she has a compact license in North Carolina, and it's unencumbered. There's nothing, currently against her license, and they kind of deal with that differently state to state. So they're probably waiting to see the outcome of the criminal investigation. Um, but Duke Health did put out a statement saying she is on administrative leave. That's all they said.
you
Well,
think?
I should hope so.
Yeah. you, you think? Jeez.
Isn't that
Wow.
crazy?
Yeah.
Like as if we didn't have enough of, as if nurse managers don't get enough hate.
Right. Now they're freaking pedophiles too. Oh no,
Yeah.
we're kidding, nurse managers. No,
Of
we're not
course.
saying that
Of
about
course.
all of y'all.
Of course.
But that's awful.
Yeah.
Well, hopefully she gets what she deserves if she actually did this. So
Yeah.
maybe she'll spend some time behind bars.
Yeah.
Okay.
Ugh. Ugh. Don't like that one at all.
All right. Well, at least this one, I don't think we need a trigger warning for this one. This is just
Well, that's good.
odd and disgusting and horrible. And I'm gonna be glancing over this article as I do it because this story just came out today. So I want to be accurate because I don't know tons of it and I want to be able to report to you guys factually. But just coming out in the news today, the title of the article reads Body of California woman found in cold storage 1 year after the hospital said she checked out. AMA. Okay.
Oh my God. I thought you meant after she died.
No, no, no. Here's the kicker.
What?
Yeah. It's horrible. It really is. I mean, that's a big difference. Oh no, she signed out AMA. I mean, she died.
Oh.
Oops. So this story is so fucked up. I'm serious. So the patient said it's a female, Jessie Peterson, and the family's claiming that the hospital negligently handled her remains and did not notify them of her death. They are suing for $25 million, okay, in California, because the family, okay, this was in Sacramento County, and this lawsuit is against Mercy San Juan Medical Center.
San Juan?
San Juan, yes. They failed to notify them of their daughter's death a year prior. They were looking for their daughter and they wanted to get an update. They knew that she was in the hospital. And the hospital told the family that she signed herself out against medical advice and was no longer at the hospital anymore. The family had been searching frantically for a year, thinking that their daughter was it's awful. A missing.
How old was she?
From the photo, she looks young. She looks like maybe late 20s, early 30s. The patient had been diagnosed, had type 1 diabetes since she was 10 years old. So they knew she had some medical problems, but was a little bit kind of stunned that she signed herself out, but then went AWOL. They couldn't find her. She wasn't talking to the family and they had been frantically searching for her for a year,
Can you
So-
imagine if your loved one goes missing like that? Like that's already a nightmare. I can't imagine. That's terrible. But if they have a serious medical condition like type 1 diabetes and they're missing, like that just adds a whole other level of terror to it, because are they getting the medication that they need,
Right. And here's the other kicker. So the mom says that the daughter called, okay, and said, "Can you come pick me up from the hospital?" Okay. And it took the mom, I think, 2 hours or a little bit longer to get there. And so when she got there, that's when they told her that the patient had left. Well, what actually happened was she died of a cardiac arrest, okay? And the family was unfortunately misinformed. She died from diabetic ketoacidosis, which we all
What?
know is a life-threatening
So
condition.
she wasn't even being like discharged? Like she
No,
was still in
no.
DKA.
Yeah. Yeah.
But she wanted to leave AMA?
I guess, or she felt something was going on and she felt uncomfortable. Or a lot
Okay.
of times, though, if you've been around DKA patients, they have an impending doom. They feel
Yeah.
like
Yeah.
something's going to happen to them.
Yeah.
And maybe she felt, who knows, she could have just felt like something bad is going to happen. I need to get out of here. Like,
Right.
who knows? But um, so um, she when the mother got in contact with the hospital, they had been told she left against medical advice, and there was nobody here by that name any longer. The patient had left. The mom says, I asked them to double check because I had seen um, her a week before and spoke to her on the phone. She spelled the name, and the man on the phone said, well, we don't have anybody here by that name. And she signed out. So they filed a missing persons report. Um, and okay, the family later found out that Peterson's remains were transferred from Mercy San Juan Medical Center to one of the medical center's off-site cold storage facilities after she died, per the documents. So she died, and they transferred her to I guess what, like one of the refrigerator things? Is that what a cold storage
Mm-hmm.
facility is?
They wouldn't go to like the coroner's office or something for an autopsy in that situation?
Okay,
I don't know.
I think they forgot about her because they didn't notify the family she was deceased until April 5th this month of 2024,
God.
361 days after
Ugh.
she died. And um, all of this should have been done within 15 hours of her death, I guess is what the protocol is. Notifying the family, autopsy, like all those
Yeah.
361 days of just sitting in this
So do we
refrigerator.
know why suddenly? Like, how was she discovered? How did they
Let's
finally
see.
like
I don't know that
inform
if
them?
it's
What led to that? Was
well,
someone like, I'm gonna deep clean the deep freeze?
they're not giving us they're not
Sorry.
giving a statement. They're just saying that they extend their deepest sympathies to the family. Um, and we're unable to comment on pending litigation.
She
But
probably still had her ID band on.
according to another article I had read, the body was already so decomposed from being in this type of storage container that they could not do an autopsy any longer. I read that from another article. So even though I guess in going back to records, they documented that she went into cardiac arrest and they tried to save her. Like all of that was documented, but
Oh,
they weren't
okay.
able to actually do an autopsy because it had been decomposed. I'm thinking they forgot about her. It's my opinion.
You know what? I
Allegedly.
wonder if like she was trying to leave AMA and they had maybe started the process.
Maybe.
Maybe you know how you get those orders, whatever, it's in the system. Um
Could
they're
be.
gonna leave, and then suddenly she goes into
And
cardiac arrest.
maybe
And then
they
so
glanced. Yeah, you're right. Maybe they glanced in the chart and saw that and
yeah, like they
assumed.
call and they get the hospital operator or someone or the unit clerk or who doesn't necessarily know, and they just
Mhm.
look it up, and it's like, oh yeah, they signed themselves out AMA. I mean, not that that's an excuse, but
No,
shit like
no.
that happens, like the communication ball is dropped often in hospitals.
And I don't know much about death and storage of bodies. I don't know how often they go from one facility to another.
My
Maybe that's
ex-husband was a coroner investigator. I think that's
does that
pretty
happen? Do you know? Do they do this?
No, no. Usually it'll go. I mean, and they do it different in different states and counties. But like here, it'll go from, if it's a coroner's case, it'll go from the hospital or facility to the coroner's office, where they
Okay.
will, you know, put them in cold freeze and do the autopsy shortly
Mhm.
thereafter, and then from there they'll release the body to the mortuary. And if it's not a coroner's case, the body can go directly to the mortuary of choice.
Well, maybe it was supposed to get an autopsy done and somebody forgot and they just left. I don't know why it was on this offsite facility, but um the somebody done messed up. That's all I know.
It almost seems
Even
like it was an unclaimed body, because that's a thing. There's a
yeah.
bunch of unclaimed bodies, and then they put them somewhere, right?
Yeah, but how long can you just let them sit in those little refrigerator pullouts? I mean, it's not like you're
You know what? Those
preserving.
aren't even real. Those are like, I mean, I'm sure they're real in some places. Those drawers are like for
They're not?
TV
I don't
and
know
movies.
nothing about that.
They
So-
don't have those where I've been in the morgue at all. They're all just on gurneys, like with a sheet over them in a big open
Ew.
room. And here's the crazy thing is because the smell, the ventilation, air circulation is so strong that you constantly out of the corner of your eye will see sheets like moving from the air circulation. We're like, that one just moved. Oh my
31
God.
she was 31. I just found it. 31 years old.
Okay.
So
Wow.
follow along, people, because this is just coming out in the news today. Today is
Wow.
August 22nd. So you can look that up, and maybe some additional facts will be coming out as the day goes on. Maybe we can give an update later and find out why
Yeah.
nobody did anything with her for a year.
Yeah, we'll try to
Almost
follow up and
Yeah.
kind of follow all of these stories and let you
Whew,
guys
oh,
know
God.
later. That's crazy.
Do we have any better stories?
Yes. Speaking of an update, I have a good update to kind of wrap this up with. So
Hallelujah.
I recently made a video about Mary Seacole, the statue of her in London being vandalized and defamed, or essentially, or defaced.
Who is
and
Mary
so-
Seacole?
Yes, for those that don't know, she was a Jamaican-born, like nursing pioneer during the Crimean War, kind of alongside the whole Florence Nightingale era. And there's a whole history there, and there was kind of like some beef between the two of them. And a lot of people feel that really Mary Seacole was much more so the mother of modern nursing rather than Florence Nightingale, and that she just never really got the props that she deserves, because she really did a lot of amazing things. And she wrote a book, and you can go read about it. Like, her whole story is fascinating. But they spent like 12 years trying to get this statue erected in her honor. And I think there was probably some resistance, that was maybe racially motivated. And they finally, after like 12 years, raised enough funds and got it approved or whatnot. And it was just erected in 2016. So it hasn't even been that long. And it's beautiful. You should
Erica,
look at the
how
pictures.
many times are you going to say erected? Erected. It was erected.
That's the word that you use.
Erica's
For a
word of the
statue.
week. Word of the week.
Okay.
I've never heard of that, but okay.
You've never heard of that? Erected?
No, I would have said they wanted to get a statue put up of
It's
Mary
erected.
Seacole.
You erect a statue. Anyway.
Okay.
It's beautiful. You should look at pictures of it. It's like it's right outside St. Thomas.
They're standing it up. Is that like
you're putting it up for the first time, like you're building it.
my mind's going to the gutter.
I know. You're bad. Anyway, it's right across from Big Ben in London, right along like the Thames River outside St. Thomas Hospital. It's a really, really beautiful statue. And so earlier this month, it was vandalized with like yellow, white, red paint all over it, and graffiti. The graffiti didn't seem to like spell out anything as far as I could tell and as far as I've read, but they did think that it's racially motivated. And of course, there's been a lot of recent racial uprisings and riots in the UK. So maybe that may or may not have something to do with it. But the good news is that they were able, this just came out this morning in the news, they received a bunch of donations, and they were able to very quickly restore the statue, the plinth, and all of it.
Yay.
So it's been repaired. It's back. It's back to normal.
It's been rectified, if you will.
It has been rectified. The
statue sounds like
rectified, and the plinth, and the light, all of it.
Well, thank goodness. At least they got it fixed. That's mean.
Yeah.
Why do people got to do stuff like that?
I know. It's terrible.
Yeah, and vandalize a pretty old statue. Yeah. I want to read more about this. I know the name, but in all honesty, I wasn't taught much about.
No one was, and that's the problem, because we were only ever taught about Florence Nightingale. And if you get into the history, and we've talked about this before, like there's significant evidence now that old Flo was, a raging racist. People get so upset whenever anyone says that or talks about it. But and that she took credit for other people's work, such as Mary Seacole, and
Oh,
yeah. She wrote a book. It's called The Wonderful Adventures of Mary Seacole, I think, but it's like her autobiography.
okay.
It's really interesting.
Fucking A. Because I have a shirt on today. Look, instead of Chick-fil-A, it says fucking A.
Oh
Open
yeah,
on
it does.
Sundays.
Fucking open on Sundays, yeah, because
Yeah,
they're
so
closed on
fucking
Sundays.
A. That's all I gotta say. All right. So do we have anybody deserving of an enema to wrap up this
Yes,
this
have
week?
an enema award, and I need to go on a little bit of a rant.
Oh,
Bear
do
with
it.
me. Oof. And you've heard me rant about this before. And it's not going to a specific person, but in general,
Okay.
to nurse quote unquote influencers out there that are putting out factually incorrect information because you just don't bother to research it. Shame
Mm-hmm.
on you. This collectively, the enema is going to all of you. I am getting really, really frustrated with this. There are a lot of social media influencers that have huge platforms. And the reality is, a lot of them have not been a nurse that long. Sometimes they misrepresent themselves and their experience. I mean, if you just look at their age, like you couldn't possibly have worked even as a travel nurse in that many places and that many
Okay. Yeah.
specialties, right?
Yeah. I've seen that.
They'll say that they have an experience as one specialty when the reality is they floated there a few times during a travel nurse contract. Like they
Right.
misrepresent themselves. Like ask them, how much experience do you really have you really ever even been a union member? Like they misrepresent a lot of things. But the thing I have an issue with is you put out information that is incorrect, that is damaging, because nurses will believe you because they look up to you and they think that you are a valid source
Mm-hmm.
of information. So there's a lot of examples of this, but the one that's been going around lately, and there's more than one doing it, is talking about how ER not giving handoff report to the floor to like a med surge unit, and saying like they don't have to. There's no law saying that they have to. It's not a requirement. That's bullshit. And if you think about it, nurses are going to believe you and not insist on getting a report. And it's not too much of a leap to assume that this could inevitably lead to an adverse patient outcome,
Yeah.
right? Because they're not going to get report and something's going to get missed. And, I've seen that happen firsthand. Like you have an obligation and a responsibility if you're going to be a social media influencer who is also representing themselves as a medical professional to do your fucking homework. Like, I'm sorry. If you can't handle that, if you can't handle doing a little research, stick to your lifestyle content. And there's nothing wrong with that, or
Yeah.
stick to like funny things, right? But you cannot be putting out misinformation
Right.
that maybe you heard from someone, but you're too lazy to look it up.
Right.
There's no excuse for that. You have a responsibility. So I'm really frustrated.
Yeah.
And
Don't.
some of these
I
people
think
I
that's
like
fair.
and I follow and I like
Don't
their other
report it
content.
unless you
But
really, really know what you're talking
yeah,
about. Yeah.
yeah, I mean,
Because.
you have a responsibility because nurses do look up to you. They
Mm-hmm.
do. And especially newer nurses, but not even just newer nurses. And they think that you are a source of information. Like I take that responsibility very seriously and I research the hell out of everything. But they're
Erica
just
does.
like,
She does.
oh my
I'll tell
God,
you
I
that.
do.
I can speak. Erica's like, I can't record tomorrow.
I
I
did. I
better
said that yesterday. I'm
research.
like, I don't have time to do the research. Well, of course, I was
I'm
up till
like,
like 1:30 in the
I said,
morning doing the
can you
research.
scale it back a bit? The research?
No.
No. I was like,
No.
well then, okay. Yeah. So I will say that she researches
I
everything as much
do.
as she
I do.
possibly can.
Yeah.
Actually,
And
this
so
week I was in charge of two of these stories, and I was a little stressed because usually Erica
it's a
is
lot.
Well, you want to make
some
sure
of the
that's
stories are like you go down a rabbit hole and then you have to verify this and that. And yeah, it can be very overwhelming. But not to get into that whole thing, but just so you know, if you're listening and you haven't seen maybe my other content on it, it is not true that the ER does not have to give handoff report to the receiving nurse, the floor nurse, if they're not critical care status. That is not true. And no, there is no law governing that, but there's no law governing most things in nursing. So like, that's a
right.
bullshit argument. That has no bearing. And it does not, hear me when I say it does not matter what your hospital policy is. That's irrelevant. They create policies all the time that are in direct violation to your nursing code of ethics, your standards of care. That's irrelevant. It will not protect you. It is a basic tenet of nursing, like one of the most basic fundamental things, that you don't just dump a patient, because that is patient abandonment. You must, as a licensed professional nurse, give report to another licensed professional nurse, period. And
Regardless of
nurses
where
have
you're
lost
sending
their
somebody
license
from.
for
Yeah.
not doing that.
Doesn't matter if it's ER, ICU, wherever you're sending somebody. I think it's a
Yeah.
blanket statement that you need to give some kind of report to somebody.
Yeah.
So,
And you know what? I want to throw something in real quick, because we recently did that episode about patient abandonment just a couple weeks ago.
yeah.
And we covered all the different crazy types of patient abandonment. But you know what I left out? You're not going to believe this, of all the things for me to leave out.
What?
And it dawned on me afterwards.
What?
A nurse going on strike is not patient abandonment. Because that's a big one that they try to tell nurses.
No, it's
if
not.
you go, but people think that and they fall for that. And I somehow didn't think of that to include it in the episode. So just as
It's
a caveat, going on
they have
legally protected strike
they have
is
proper
not.
warning. Yeah, they tell sometimes weeks in advance, Erica?
They have to give 10 days minimum.
10 days. Okay. So
Yeah.
they're not just like walking out on their
No.
shift. So
No.
not patient abandonment.
Not patient abandonment. I should have included that on that episode.
All right, guys, let us know what name you like for this podcast. If you want us to keep
I
it
vote for
Whiteboard
Huddle
update or Huddle update. I kind of like Huddle update too, but we want to hear your thoughts on it. And as always, please like, share, follow, subscribe. I don't know. Leave a comment.
Download.
All of our podcast episodes. It really, really helps us out. Until next time on the next Nurses Uncorked.